and for all I know, I might be a carrier. And so our thinking is that the carrier is perfectly normal, that the child with PKU, though, would be mentally retarded because we didn't know if have any treatment for it. And the confusing thing is that the mental retardation is not apparent at birth. The babies look perfectly normal, but about 3 to 4 months of age, they don't turn over like they should. So it's a disease that slowly takes effect over a period of several months. Well, that didn't make them very happy, and they left and never came back. About that time, Dr. Robert Guthrie, who is a famous physician in New York, developed a screening test for PKU. Coincidentally, another doctor in Great Britain developed a diet that was supposedly effective in preventing the mental retardation in PKU. And the diet was a nasty thing because the product tasted awful, and on the other hand, it did not contain any phenylalanine in the product. So you could treat the patient by feeding the child this particular product that Dr. Bickel had invented. And I call it an invention because normally the diet you and I eat contains maybe 2,000 milligrams of phenylalanine. And in some people, like I know, it's probably even more, where they're big steak eaters and bacon and eggs for breakfast and all the protein-containing food. And that's containing phenylalanine in a large amount and would cause brain damage to a patient who has PKU. So it was a challenge because the diet did not taste good. The first child I had was a 3-year-old, and he took one taste of it and he spit it out. And she couldn't feed the child the product orally, so that was a failure. And that child today is 47 years old. He's in a state hospital for the mentally retarded. He has 0 IQ and he has convulsions. And I don't expect him to live many more years. So that was a classical failure to begin with. But after that, we learned that if you had a child that would not take it, you could put in a gastrostomy, which is a tube into the stomach, so that he doesn't have to taste the product. I got more interested in PKU as I ran the developmental center, and it turned out that about 1 to 2% of the children I was seeing had PKU.
Screening for PKU didn't begin until 1957. A simple blood test done within 24 to 48 hours of birth can determine if a baby has PKU.
And I still follow about 100 patients with the disease. And I'm really proud of the work because nearly all the patients that are represented up here on the board are patients that were diagnosed with newborn screening and were started on the diet during their neonatal period and are healthy and normal. And I have several now that are married and have children who are perfectly normal. And so the most example of one would be Roy over here, who's 52 years old today, and he has 2 children. Most of my patients live in LA County or Southern California, but they come from as far north as Washington and Oregon to see me because there aren't many physicians that know much about PKU as an adult. So it's been a remarkable experience for me to see these patients over the years, and I found that I really kind of enjoy seeing adults after being a pediatrician for a long time. So I'm very enthused with that, and I was responsible actually for getting the state of California to initiate the newborn screening, and Governor Pat Brown actually had a signing ceremony for the bill that passed in California, in Sacramento, which was sponsored by Senator Green. And he looked up at me and he says, "Do you think this is a good bill, Dr. Koch?" And I said, it sure is. It'll prevent mental retardation in these children. And so that's how the newborn screening program began in California.
Scientists at BioMarin have developed a new drug, phenoloptin. With this new tablet, it could not only change, but revolutionize the way PKU patients live. With the drug, they would no longer be stuck to such protein-limited diets. If doctors like Richard Koch keep fighting for the approval of this drug, PKU patients could be free to live a normal life, just like the rest of us.